Hi everyone, and welcome back to 2-Minute Teas with TP. I'm Teresa Pun, and today I'm still drinking some water during my stinging insect venom series. I want to talk to you a bit more about who would benefit from testing to stinging insect venoms. So first and foremost, patients who have had an anaphylactic reaction to a stinging insect venom would definitely benefit from testing. Typically in that scenario, a patient gets a sting and within minutes, maximum 2 hours, they develop a generalized rash consisting of hives all over their body. They might get some swelling of the face, their tongue, their throat, and they would also have involvement potentially of the respiratory system with coughing, difficulty breathing, wheezing, or their cardiovascular system with fainting due to low blood pressure. The reason we definitely want to test these patients is because we want to identify the specific venom that the patient is allergic to and then to treat that patient accordingly. Now, there's also another group of patients that may or may not benefit from skin testing, and these would be patients who develop what we call an isolated cutaneous or skin-only reaction to a stinging insect venom. Now, to differentiate from large local reactions, the skin reactions that these patients get occur at spots in their body that are not contiguous with the original sting site. So for example, the patient might get stung on their pinky finger, right here, but then still get generalized hives on their shoulders, on their chest, all over their body. But if that's the extent of their reaction, then technically they don't really need skin testing because their risk of anaphylaxis is still quite low. The only time we would consider testing and treating these patients would be if that patient had a lot of exposure or was at high risk. So a typical example would be a bee farmer, meaning that yes, that patient has been stung a few times and has only had a hive-like reaction with no compromise of their breathing or their cardiac function. However, they're at such high risk of subsequent stings that it would be reasonable to treat that patient. I hope this was helpful, and I'll do a few more videos on this as well. Thank you.